Hello everyone, and thank you for participating in my educational session about the massive transfusion protocol and the use of the Belmont Rapid Infusion Machine. Our goals for the training session include assessing the patient for appropriate vascular access for use with the rapid infusion machine, organizing the required disposable supplies to initiate massive transfusion, and identifying the additional staff and reference materials to safely initiate massive transfusion. What patients are at risk for needing a massive transfusion? We know that patients who are receiving more than 8 to 10 red blood cell products in 24 hours are at risk. Patients who require 4 to 5 units of red cells in 1 hour likely will require massive transfusion. The most frequent use of the MTP protocol is in labor and delivery for postpartum hemorrhage. Other patient populations include ruptured aortic aneurysms and GI bleeds. The massive transfusion protocol is a standardized method for treating patients with massive hemorrhage. The policy from the intranet is the most current version of our official nursing policy, and it provides step-by-step guidelines. I've also created a checklist that you'll find in this training that can be used to guide everything from identifying massive transfusion, initiating it using the code operator, and then step-by-step setup for the Belmont machine. Massive transfusion is administered in rounds. Each round of blood products consists of 6 plasma units, 6 red blood cell units, and 1 apheresis platelet unit. Cryoprecipitate is administered by request when the fibrinogen level is less than 100 milligrams per deciliter for general transfusion. In the obstetric population, the level is 200 milligrams per deciliter or less. Fibrinogen levels will drive cryoprecipitate, and cryoprecipitate will only be sent when requested by a provider at the bedside of MTP or suggested by the pathology department who is following our MTP progress. As soon as you have identified that a patient will require massive transfusion protocol, it's critically important to activate the MTP team by calling 111, the code operator, with the following information: the patient's name, date of birth to indicate whether this is adult MTP or pediatric MTP, patient medical record number, the patient's location, the name of the licensed independent ordering provider, your name, and your callback number. After this has been done, it's important to verify that Initiate MTP order has been placed in Epic. Who is notified of a massive transfusion protocol activation? The blood bank, patient support services, who will serve as the primary runners for blood products from the blood bank, the rapid response team emergency response nurse. These individuals respond to every MTP in our inpatient population. The pharmacy, the hematology lab, and the ANC administrative nurse coordinator. As soon as an MTP has been initiated, it's important to assess the vascular access status of your patient. Although large bore IVs are ideal, the most important thing is that you assess each vascular access for patency. So large bores is excellent, but patent access is the most important thing. You can do MTP through a smaller bore IV, you just have to pay attention to the flow rates and the limitations that smaller catheters have with flow rates. As you can see here, there's a chart that's provided with the Belmont that indicates the maximum achievable flow rate for each gauge catheter. It's also important to remove claves and connect Belmont tubing directly to catheter hubs. This will reduce the amount of resistance that the claves present when trying to achieve rapid flow. It's also important to note here down in the orange section that platelets and cryoprecipitate require a dedicated IV site because they cannot be heated in the Belmont line. Platelets and cryoprecipitate can have their coagulation factors altered when they're heated through the Belmont Rapid Infuser. For patients with triple lumen central venous catheters, the largest gauge is the distal brown port, which is a 16 gauge lumen. For patients with a quad lumen CVC, you would use the medial gray port, which is a 14 gauge lumen. As the picture indicates with the red circle, you will connect the Belmont Rapid Infuser administration set directly to the hub of this port. You will remove the clave and connect the tubing directly to the hub to reduce resistance and achieve optimal flow rates. So you've declared an MTP by calling 111, the code operator, and providing all of the necessary information. You have verified that the license ordering provider has entered initiate MTP into Epic, and that will populate all of the labs. Now, after you have determined that the patient has adequate vascular access, it's time to draw the baseline lab specimens while you're waiting for the first round of blood. The baseline labs that will populate in Epic include a blood bank type-in screen, PT-INR, CBC, fibrinogen, and ionized calcium. Once those have been sent, you should receive the first round of blood and you can begin transfusing. You will track MTP based on lab values, and those are PRN orders that are automatically populated in Epic once the order has been entered. The PRN orders are drawn beginning with round 3 on the odd rounds. They include PT-INR, CBC, fibrinogen, and ionized calcium. This is an image of the Belmont Rapid Infusion machine that we use at the University of Vermont Medical Center. It's actually quite simple to set up. As you can see, there's a 3-spike administration set that leads to a chamber there on the IV pole and then the machine below. It warms and rapidly infuses normal saline, red blood cells, and plasma. Those are the only 3 things that we put through the Belmont Rapid Infusion machine: normal saline, red blood cells, and plasma. We do not use the Belmont Rapid Infusion machine for platelets or cryoprecipitate because heating those 2 blood products can alter the coagulation factor. Again, the Belmont Rapid Infusion machine is relatively easy to set up. The first part of the administration set has the 3 spikes. We will spike one of those with normal saline and keep the other 2 sterile and clamped. The chamber that leads directly distal to those is an air evacuation chamber, and the Belmont will evacuate air for you. And then it goes into the circulate, recirculate section of the administration set. And then the last part of the picture here is an extension line. And we recommend that you position the Belmont at the foot of the bed so that 2 nurses can operate, or a tech from the ER can operate the Belmont Rapid Infusion machine. So the 3-spike administration set with a patient line extension set allows for the machine to be placed at the foot of the bed. Momentarily, we'll take a break from this presentation so that you can watch a video from the Belmont manufacturer. This is the recirculate portion of the machine, which shows you how the blood product or fluid circulates through the machine and identifies the different parts of the machine for you to refer back to. At this point, please stop and refer back to the handout where you can click on a hyperlink to the Belmont Rapid Infuser instruction video from March 2020.